Hello, this is Dr. Jerry Law, Director of Family Education and Leadership Training for Meadows Behavioral Healthcare. Thank you for watching this video in which I would like to give you an overview of the many activities and therapies in which your loved one may participate during treatment. Occasionally, I receive a call or email from family members whose loved one has informed them that they're just not receiving enough treatment or individual attention, and in some cases, complaints of just having nothing to do. Well, the purpose of this video is to make you aware of what a day in treatment looks like, along with an overview of the many opportunities your loved one has to engage in the programming available. Even if you're not hearing these concerns from your friend or family member, I hope you'll find the information in this message helpful. While not every activity outlined in this video is applicable to every patient due to some variations in programming between our programs and/or the physical variations or limitations in emotional health and well-being of your loved one, the vast majority are common to all of our locations. So let's begin at the beginning. Upon admission, your loved one will participate in an extensive medical and psychological evaluation. Depending on the unique circumstances, health issues, and medical history of the patient, this may be brief or may actually take a day or two. Thoroughness is key. Your loved one will meet with a comprehensive medical team for this initial evaluation, and he or she may need to stay in supervised care initially for their own safety and protection. Often, issues such as detoxification and/or medication management determine the length of stay in this area of the facility, as well as the amount of group therapy or other therapeutic modalities in which your loved one may participate. So during this time, your loved one will receive therapy. However, it may be somewhat limited due to the realities mentioned before. In some cases, patients believe that they're not receiving the benefits of therapy they were expecting. In reality, they are receiving exactly what they need at this time. It is counterproductive to place an individual into activities for which they are not physically or emotionally ready. Were they asked to participate in therapeutic programs that are not appropriate at this point in their treatment, may actually set them back. The full medical and psychiatric team will be actively involved with the patient, making sound clinical judgments as to when to transition a patient into full programming. Once your friend or family member has transitioned to this next level of care, a typical day is very busy and filled with robust programming. Even so, your loved one may share his or her concerns that they have, quote, nothing to do. Please be aware of a couple of key thoughts here. First, depending on what brought your friend or family member to treatment, it is possible that for some time they've been living a rather chaotic lifestyle, one that is lacking balance and often filled with unhealthy activities or unscheduled. Now that they find themselves in a structured, scheduled environment that they are not able to control or manipulate, this may be uncomfortable to them. It's no wonder that a new balanced schedule might seem a little bit slow or even boring to them. Secondly, and I truly hope you'll receive this in the spirit of support in which it is intended, your loved one may not be giving you an accurate report. Well, I hope it's not intentional, though it may be. This may simply be a reflection of their state of mind at the moment. Many patients are transitioning through medication changes or experiencing post-acute withdrawal symptoms, and their perceptions around programming may be impacted by these conditions. As difficult as it may be for you to hear, your loved one may not be as forthcoming with you as you would hope, especially early on in their stay. In many cases, patients are beginning to feel their emotions for the first time in a long while, and this too can be very uncomfortable for them. Blaming a perceived lack of progress or shortage of things to do may be more a reflection of experiencing these newfound emotions and less about taking advantage of the help that's available. It's also possible that your loved one came into treatment reluctant to do so or as the result of some type of intervention. In these cases, your friend or family member may not be happy with you and may express their unhappiness with the program in an attempt to punish you. Well, this doesn't happen often, but we hope you will keep this in mind. Occasionally, loved ones simply don't want to share what they are experiencing in treatment with family members, and it becomes easy to simply say, gee, I don't have anything to do here, rather than to present the full picture about what they're doing. Now, by no means am I advocating that you ignore your loved one's comments. Rather, I hope to provide some context through which to filter that information. So, just what is available, you may be asking. Well, here's a quick rundown on the opportunities in which your loved one may be able to engage. While not every item I mention is applicable to your friend or family member, the vast majority are. And I believe that you will be able to see that in all cases, there is plenty to do. Most days, your loved one will be given an assignment to complete during their free time. Many of these assignments are to be completed before their next group session, while others may take several days to complete. In addition, early on, your loved one will be given numerous books to read that are specific to the issues they are facing. Just reading all these books takes a great deal of time, and we hope you will encourage your loved one to do just that. Work on those assignments. Each day, your loved one will have a detailed schedule to follow. Here's a listing of some of the types of activities on their daily planner. Group therapy sessions, psychoeducational lectures, EMDR or somatic experience sessions, neurofeedback and other brain center activities, 12-step meetings, medical appointments, psychological appointments, testing appointments, psychiatrist appointments, medication management, nursing assessments, recreation time, dietitian appointments, Tai Chi or yoga, acupuncture, community meetings, equine therapy, expressive arts therapy, chapel, community meetings, nutrition education, meal preparation, mindfulness therapy, grief and loss work, meditation, ropes course, journaling, psychodrama sessions, self-defense classes, fitness center, and much, much more. As you can see, there's a lot to do. In addition to the activities just listed, most patients will have opportunity to participate in Survivors Week and Family Week. As the name indicates, these are week-long, Monday through Friday intensives, during which your friend or family member will be able to do a deep dive into trauma, maybe family of origin struggles, dysfunctional communication patterns, and more. 2 full weeks of your loved one's stay are involved in these life-changing activities. We also believe in the power of good nutrition and provide 3 square meals a day along with nutritious snacks. Your friend or family member will be encouraged to practice self-care through some needed downtime and opportunities to relax, maybe soak up some sun and fellowship with their peers. We do live in community, and frankly, we heal in community. Most of our programs also have evening and weekend therapists on site, and your loved one can set an appointment for one-on-one time with these master's level therapists as well. Well, I could go on, but I think you get the picture. So how should you respond when your loved one informs you that they're bored, have nothing to do, or they just don't believe they're getting the individual attention they deserve? Well, it might sound trite. We encourage you to trust the process. At the Meadows and all of our programs, we have been successfully treating individuals dealing with a wide range of issues for over 40 years. Our programs are evidence-based and built upon the Meadows model, which is world-renowned for its effectiveness. So let me say it again. Trust the process. On a practical note, learn to use redirection language. Let your loved one know that you take their concerns and comments seriously, and that the best thing they can do is to take those concerns to their clinical team. Your loved one deserves the opportunity to advocate for themselves, and encouraging them to do so will go a long way in creating the healthy relationship with them that you desire. Now, of course, you as concerned family members can contact us with any concerns you may have. And our hope is that you will use these redirection skills with your loved one that sends a message that you believe in them and their ability to practice self-care. Well, if I can be of further assistance while your loved one is in treatment, please feel free to contact me at jlaw, that's JLAW, at themeadows.org, or give me a call, area code 928-668-1942. I look forward to supporting you in any way that I can.